Welcome to Prime Life. We call it Retirement 2.0. Leave each episode with tips and new ideas to help you navigate retirement in our new age. It's your time. Make it count.
This podcast is for educational purposes only. It is not intended as medical, investment, or financial advice. We do not sponsor or endorse any of the individuals, companies, products, or services featured on this podcast. Any statements or opinions expressed are of the individual who makes them. We hope you enjoy the episode.
Hi, I'm Mary Crean, and welcome to another episode of the Prime Life Podcast. We're all about longevity here and lots of other topics. And I'm here with my co-host, Joseph Katz. Joseph, what's up today?
Mary, I am doing great. Thanks for asking. Excited for our conversation today. And if you hear some noise in the background, I apologize, but some
That's
screaming
okay.
kids in the other room.
It's all good. Beautiful voices in the background, I am sure. Without further ado, let's kick it off to you to introduce our guest.
Thank you so much. I'd like to welcome to the show Matt Feret. He is the founder of MF Media, host of the Matt Feret Show, and author of Prepare for Medicare, The Insider's Guide, and a growing series of books and workbooks on Medicare, Social Security, and retirement planning. A former Medicare industry executive, he's building a national platform to help people cut through the noise and live smarter, healthier, more confident lives in the second half of their life. So, perfect person to have on our show, Mary, right?
It really is.
This whole topic of Medicare should be fun. So, Matt, tell us a little bit more about yourself, how you got into this space, and we'll go from there.
Yeah. Hey, guys. It's really nice to see you. And thanks so much for having me on. Joseph, you did a great job. That's me in a nutshell. So I spent more than 2 decades in corporate insurance, specifically corporate Medicare insurance. And I don't know, about 4 or 5 years ago, I got this brilliant idea to write a book. It was pandemic time. So probably like all of you or anybody listening or watching, wandering around the streets with a mask on sometimes, and then thinking I was crazy for walking outside with a mask, and who knows, right? But had a little extra time and my brain was racing. And so I go on very, very long walks and email myself repeatedly about what kind of a book did I want to write about Medicare. I knew there were some out there, but there had to be a better way. There had to be kind of an insider's way. No one from inside the industry was writing it. And so I was like, you know what? A big purpose of my life, just as on a personal note, is helping people. I like it. I just enjoy helping. And it probably comes from having 2 educators as parents. I mean, that's how I grew up. It was education for the sake of education and helping people. And so I'd started writing, and by the end I had the Insider's Guide, which is, hey, I work in this, and let me tell you how this is and how this works, and be fair and as balanced as I possibly can be, and what to watch out for. And guys, I just put it out. I didn't know if it was going to sell 0 copies or 1 million, but I just put it out there, and it's done really, really well. But I don't mean even from a sales standpoint. What I mean is I get emails every week from people, and these are the best things ever. Hey, Matt, I read your book. Just wanted to say thanks. Talk about validation. It's just, I like helping people. I like showing people kind of the insider track. And, there's so much noise about this out there. There's so many different, entry ways into the stuff, and ads. And there's just so much noise. There's newspaper, Wall Street Journal articles for the last couple of years. So I like cutting through the noise and providing clarity and helping people. And, if you just read the free preview or listen to a podcast or, use any one of my other books or workbooks, and it helps you and you give it to a couple of friends, that's awesome. That's the best thing. So a little while ago, I decided I'd had enough of corporate. I've worked for big companies, national brands, small state-based plans, regional companies, nonprofits, for-profits, mutual companies. And I just reached a point where, I'd done a book, and then I'd done the Prepare for Social Security book, and I had a couple more in me. And a bunch of the people I work with on the books piece and around were like, nobody does courses on these things. And I don't mean just YouTube primers or, hey, here's a nugget of Medicare information. Now buy something from me. Just really, again, kind of mirroring the books. And so I went, I think it's time to do this. My wife has been an independent Medicare insurance agent for about 9 years. And about 3 years ago, she started her own Medicare insurance agency. And it is the modern insurance agency. And by that, I mean, it's on Zoom. It's over the phone. It's by appointment only. There's no outbound. There's no wild lead generation. It's all a boutique Medicare experience. And the word boutique is important because it's small. There's a handful of agents that are trained well, that are doing the right thing. It's a two-step process. It's not a get on the phone and try to close somebody on a sale. It is let's spend the first half hour trying to understand who you are, what you want out of this, how do you use it, what are your fears, what are your misconceptions, and that's it. And if you want to move forward, she moves forward to the second and sometimes third and sometimes fourth meeting. And, she did it because she shares a lot of my values. Heck, I'm married to her. And so brickhouseagency.com is where she made her mark across 37 states, and it's resonating. And so, a little while ago, I was like, she's doing the right thing. I'd like to do some more. And so we're putting it all together. And so I run MF Media, and MF Media, like you said, Joseph, is a retirement education platform. It combines the Matt Feret Show, which is for people trying to live, age 50 plus in the right way. Yeah, it covers boring stuff like, no offense, like financial planning and annuities and all that sort of stuff. But it also, I've got episodes with people. I'm like, hey, are you downsizing? Do you need help? Here's a professional downsizer. Here's how to go through your basement and figure out what to toss, what to keep, and what to give away. So it's really wide ranging of living your best life over age 50, whether or not you're retiring earlier than 65, or you're working all the way through 75. It just does that. So it's a retirement education platform. So right now it's podcasts and books and courses. But in the coming months and years, my goal and my vision is to have it under all one umbrella of curated sources, curated people, like Brickhouse, right? It's curated. It's a boutique experience. It's high touch. It's not pushy. We follow. She follows up with emails and even a handwritten card on your policy anniversary day and happy birthday notices. Just kind of the way you want to be treated. And that's where I'm going to take MF Media, is curated experiences, having everything to do with retirement, not just stocks, bonds, what to do with your 401k, should you buy a Medicare supplement or a Medicare Advantage, but, travel, relationships, Joseph, right, with that background, your grandkids there. How do you create meaningful relationships and connections to your grandkids, even if you're living 10 states away? So that's my vision for what MF Media is going to do from a retirement platform or let's just say over 50 type platform. And I'm really excited to get started. I've done a ton of work. I had a book come out a couple of weeks ago. I've got 2 more books coming out between now and September. So, and 4 more courses. And so really just, when you don't have Teams or Zoom meetings from 8 to 5 or 8 to 7 every day in corporate America, it's amazing how much you can just do when you don't.
It sounds like you don't have anything going on. You're just sitting around, twiddling your thumb.
A couple of friends, very close friends, were like, what you should do? You should go to the beach for a month. And I went, that is so not me. I've had this. I've got these slimline notebooks. I'm not one of those. I got a cell phone and again, an iPad. I almost said iPod. But I've had notes on what I wanted to do for this for years. And so I opened up old notebooks and I was like, okay, it's go time. I'm going to go do this because I think there's a real need out there for people to get kind of direct, experienced, dare I say, insider truths about particular topics around retirement that need to be curated. Think of all the talking heads on YouTube and all the talking heads on your flashy Instagram posts. It's all segmented. It's all to use a corporate phrase. It's all siloed. So you're going to get your annuity experts, right?
And so then what you're saying is I shouldn't Do you make a decision based on an Instagram or TikTok?
Yeah, that's correct. Very good. Yeah, but it's siloed, right? It's almost every single topic is siloed, and then there are 58 people online barking about every silo. How do you put this all together?
Right.
How do you sit down at age 64 and go, all right, listen, I've deferred Social Security until I'm 70. I know I got to worry about Medicare. My spouse is 62. What do I do about my spouse? I've got an old 401k. I've got a pension kicking off. When does that happen? I think I want to downsize. Maybe I get rid of the cabin, and maybe I want to travel in my RV. And I just had my third grandkid, but they live in California and I'm in New York. How do I make them more meaningful? Hey, I'm retiring. I like to golf, but guess what? When I retire, all of my friends I golf with are still working, and so it's 2:00 on a Tuesday, and I have no friends because all of my friends were at work because I identified with my job for the last 40 years. It's those things all together that I don't think anyone really puts together, and that's really my ultimate goal with MF Media is that retirement kind of middle age into retirement educational platform.
So kudos and congratulations for all those accomplishments, because that's pretty amazing. Just level setting here. And we hear this all the time. I love what you said earlier about, trying to rise above the noise. But from what I'm hearing from you, it sounds like you're putting the human and the trust factor really out there and putting it at the forefront of all the education that you are providing. And you're putting yourself in people's shoes and saying, you don't know what you don't know. So what would I want to know? And you've been in the industry. So I'd love for you to talk a little bit about what are a couple of things right off the cuff that maybe individuals who are approaching retirement or in retirement should know about Medicare in general, and perhaps probably don't know.
And we'll get that answer after a brief word from our commercial sponsors.
NASA is always working harder to be your carrier of choice. We offer insurance products that can help you meet your retirement goals, such as protecting your savings, securing lifetime income, or paying for healthcare costs. We're dedicated to providing best-in-class service and are keeping things simple, and we'll have your back. We have around 400,000 policyholders and contract holders and have been doing this for a long time, 170 years, but we remain humble enough to always try to improve. For more information, visit nfg.com. Nassau insurance products are issued by Nassau Life and Annuity Company of Hartford, Connecticut, Nassau Life Insurance Company, East Greenbush, New York, or Nassau Life Insurance Company of Kansas, Overland Park, Kansas. Subsidiaries of Nassau Financial Group. Products are not available in all areas. Policyholder counts are for all Nassau companies as of September 30th, 2022, and are subject to change.
Sure. One of the biggest questions, actually, it's really the number one question I always get, is which one should I choose, Medicare Supplement or Medicare Advantage? And actually, that's the title of the book I just released because everybody asked me. So I thought, I don't know. I'll give you a book. Try that. And there's a course as well. That's the number one. And asking that is like, and I know this is a bad example, but this is a financial and retirement show, so hopefully it'll hit. It's kind of like asking, well, how should I handle my long-term care? Should I buy a long-term care insurance policy, or should I use an insurance product with an LTC rider? Or should I self-fund out of my retirement savings? Or should I spend down my assets, and use a Medicaid strategy? Okay, those are all ways to get to an end result, but they're all very, very different. They're not the same. So in the Medicare Advantage piece, look, this is my opinion. And I've been on the inside for a really long time. Medicare Advantage has been oversold. That's what I believe. It's been overrepresented as the fix-all. I think a lot of it has been old using benefits. I call them in my books the bright, shiny, flashing light things. when people go, I need dental and I want $20 a month on my over-the-counter card, and I'd like a gym membership. Well, that's great, and those are all wonderful things, but you know what you really ought to be paying attention to? The MOOP, which is my favorite acronym of all time. MOOP. That's called the maximum out of pocket. So every year there's a medical maximum out of pocket on the Medicare Advantage plan. Sometimes it's $2,000, sometimes it's $7,000. Okay, that's a $5,000 a year difference. You can pay for a crown and a cleaning and some fluoride treatment and be nowhere near $5,000 on a dental plan. Your gym membership, what's that cost you at Planet Fitness? $25 a month? Okay, great. So for $300 a year, you can get a gym membership. So I think it's been oversold. I think the concept is good. I understand it, obviously, but I think it's been oversold. And why I say that also is because the coverage over the last few years has reduced. If you're maybe if you're on Medicare and you have Medicare Advantage, you picked up on this, or if you're an agent listening or anybody else, but last fall, right, for 1/1/2025, there were over 1.2 million people on Medicare Advantage across the country who had their policies deleted. The carriers exited the market. So what does that mean? That means your mom or your grandma had a policy, and then she got a letter and said, hey, guess what? I know you've had this, but it's going away now. So you have to do something. You can either just go back to original Medicare A and B, which has, of course, that 20% and no maximum out of pocket. That's unlimited. Or you've got to actively go out there and find a new Medicare Advantage plan. And oh, by the way, in most states, if you're trying to get a Medicare supplement, you're well outside of your window. You may have to go through medical underwriting. Okay, it's the old what would I want my mom to experience rule, which I filter everything through. I want to put my 79-year-old mother through this. She's going to call me. I mean, thank God I know what I'm doing, but not everybody worked inside the Medicare insurance industry for 25 plus years. But the point is that the financials behind this is why companies pull out. When they're not financially performing and they can't fix it over time, they leave. And so that put people out on their ear. You know what's going to happen this fall? No one's allowed to talk about benefits until, October 1st for Medicare Advantage, so I won't. But I've been in this industry for a long time. I hear what's going on. The bids are already filed. The bids were filed the first week of June 2025. It's going to happen again. It's going to be as bad or worse than it was last year. So there are major and minor carriers that are completely pulling out of markets. They're slashing their benefits. They're increasing their premiums. There's a whole host of reasons behind it. But I think when I get back to why I think Medicare Advantage is oversold, I think it's because it's an annual contract, and people don't realize, hey, they could just stop offering this plan and you're out on your ear after a year or two or three. The other piece I'll say about Medicare Advantage is there's this other thing called Medicare Supplement. And look, let's face it. I mean, I really think really good, trustworthy, independent insurance agents are worth their weight in gold. Heck, my wife's one. So, I know the good ones. Let's just be honest. The commissions and the overrides or admin fees on those things on Medicare Advantage are significantly higher than they are for Medicare Supplement. So if that's, let's say, an organization or someone is working for commission, I can completely understand why someone may start with a higher commission product. Does that mean that they're unethical? No, I don't think so. But it may mean that the first option or second option or third option may have always been Medicare Advantage and not necessarily Medicare Supplements. So that's why I kind of get back to, this is a very individual discussion. Right. And I talked about, Nikki and Brickhouse earlier. This is why it's a 2 to 3 sometimes or 4 sometimes step process, because you can't just, hey, oh, you need Medicare. Okay, well, let me start with this plan. How's that sound? Okay, wonderful. Let's get you enrolled. No, it's very specific to the way you consume healthcare, your risk tolerance, your health profile.
Where you live.
I mean, where you live. Oh my gosh, where you live. Rural America is wildly underserved by Medicare.
Drugs you're taking.
Drugs you're taking. It is.
How am I doing, guys? How am I doing?
Yeah.
I think you're hitting exactly.
So Matt, can I ask you a question? Because you hit on the financial, both sides of the equation, right? The companies exiting markets because of underperformance, and the other side, companies selling products because of higher commissions.
Mm-hmm.
What are your thoughts? Your opinions, obviously, on some of the marketing tactics these companies have used. Right? You watch TV on any evening, you're going to get hit with it's going away, time's running out, like all the fear factors sort of things. And obviously there's windows, and there are times that people need to be aware of. It doesn't apply to everyone in every situation because it's, like you said, very specific. Do you think that's helping or hurting? It's sort of a leading question, I realize, but
no, I'm torn on this answer because I have a lot of background in marketing, and there are a lot of opinions on this, right? And Medicare and CMS have cracked down really hard on this sort of thing. I personally don't believe that TV commercials are the devil and that they're misleading. I know we've got those D-list celebrity commercials that we all see and laugh at. Those, to me, aren't really the problem. Think of all the silly local commercials you see on TV, the car commercials. Is that forcing someone to buy a Chevy? No, it's not. Is that preying on an audience that, wants to buy
but the difference though is, everyone most people know, I shouldn't say everyone, that they have to sign up for Medicare at a certain point in time. They know that there are certain windows. They may not know what those windows mean. And that's where I think people like you come in and educate.
Yeah.
But they see these commercials, time's running out, last days, 7 days, whatever you've seen them.
So here's what I'll say in summary. I personally don't believe TV commercials are the devil. I think they're doing what every other ad should do, which is try to drive engagement and try to get someone to engage. Where I see and where I saw from the inside, here's where I think the problem is, Joseph. It's the marketing resellers. It's the lead generation companies that you have no idea what their names are and you have no idea who they are. And they take your information. If you fill out an online form or you enter in your cell phone number somewhere that says, hey, get a free PDF download of your Medicare rules. And what they do is they resell those over and over and over and over again. So I think everyone, and I don't mean you specifically, Joseph, people go, the TV commercials are misleading. Well, okay, if they're misleading, there are rules and they'll get smacked and they won't be able to run them because all of these TV commercials have to be filed, sometimes not only with the Medicare insurance companies, but also with the feds. You've got to file these with the Medicare piece with all the disclaimers.
Right. So I don't think people read the disclaimers, but they're there.
No. But my point is, what you hear even before the disclaimers has been approved by somebody. This isn't, this isn't me making a TV commercial without anybody checking my stuff. I think the problem more has to do with when there are leads and when there are people that are lead aggregators and lead purchasers, and they recycle and resell and resell. That's how my mom gets 58 phone calls, in 2 weeks during the annual election period.
Right.
So because maybe the problem is not so much. You mentioned the lead generators, which is obviously part of the system.
Yep.
It's the education, though, right? Like So you're trying to solve a problem by providing education.
Yes, 100%.
Right. But these lead generators and even the insurance companies aren't trying to provide education. They're trying to sell products and services.
I think my answer would be it depends. If you're working for an insurance company and the insurance company is advertising, the insurance company owns or contracts very closely with the call center. No, this is a federal contract they have. They can't afford to break the rules. And so, if you're looking at some sort of national or even regional organization, no, their scripts are tight. Everything is compliant. They have to read their scope of appointments. They have a 48-hour rule. They're doing everything by the book. I think where it gets dicey sometimes is where you've got, again, going back to lead aggregators and lead generators. You don't know who you're talking to. You don't know what call center this is. There are large call centers that do a very, very good and compliant job. Again, these are sometimes publicly traded company, but even private companies worth millions and hundreds of millions of dollars. They have no desire to get in trouble with the feds, number one, and no desire to get in trouble with the carriers who are paying them commission. So that's why I'm trying to draw that line of delineation of, like, I don't think advertising Medicare insurance is a bad thing. I think there are ways that people do it all day long compliantly. Where I think is this underbelly that no one really sees that leads to all the complaints. Now, do individual agents, going back to my Medicare Advantage has been oversold? Or do they lead? Yeah, I think they probably do. Should they? My personal opinion, no. I think a balanced educational approach of, look, there are two ways to do this. Largely two ways to do this. Here are the pros and cons of one. Here are the pros and cons of other. Right? Not just what are your prescriptions, who's your doctor, but how do you, how's your health?
How often do you go to the doctor?
Yeah. Did you have prostate cancer at age 55 and now it's in remission? It's probably, probably want to think about a Medicare supplement or a comprehensive Medicare supplement in that way. Cancer can always come back. What's your family history of heart disease? Did the 3 prior versions of you all die at age 68 from a heart attack?
So to that point, I think that's to the education piece. Probably is not coming across where people are thinking, you use the Medicare Advantage, I'm paying $20 a month or whatever, where the supplement type of a plan where you're paying a higher out of pocket, but long term, you're going to pay less, right? If it's an education, pay now for later kind of thing.
Yeah, it's kind of, do you want to pay as you go with some potential big gaps in there with the Medicare Advantage? Because let's face it, Medicare Advantage really operates a lot like what people are using at work, right? There are co-pays for your primary care positioning, co-pays for your specialist, and people are kind of used to that. But, you got to look at the gaps, you got to look at the holes. In most Medicare Advantage plan designs, if you get cancer, you're out 20% until your maximum out of pocket. That adds up real fast. Let's talk about out-of-network real fast on Medicare Advantage. Okay, so we all know the Medicare Advantage HMOs. And I think we've largely gotten over as a society the 1980s version of HMOs are horrible. But there are things called PPOs, and they're really, really, really popular. And why not? You've got in-network benefits and out-of-network benefits. A lot like what you usually had at work. Look at your out-of-network benefits. Look at them. I'll just say, again, caveat, my opinion, most of the time they're horrible. In fact, most of the time they're worse than original Medicare. You can have out-of-network PPO benefits with a massive deductible before anything kicks in, and then 50% coinsurance until a maximum out of pocket of, $12,000 a year. Well, I guess it's better than not having out of network, but Medicare A and B is basically 20%. And out of network MAPD PPO can be 50%. Why would you do that? I don't know why you do that.
Because people aren't doing the math.
Right.
No one knows what's going to happen tomorrow, but if you start thinking through what might happen and do if-then sort of scenarios.
So it sounds like, Matt, one of the things that you do with your book and your podcast and all that you're trying to accomplish. Mm-hmm. And do you believe that it's about laying out, like Joseph was alluding to, the options so they're a little clearer for individuals? You talked about a lot of great things that maybe some people wouldn't think about, like if you had cancer, again, like Joseph said, none of us know what tomorrow will bring.
Right.
But with your educational book and et cetera, podcast, how are you laying out perhaps differently so individuals go from being so overwhelmed? Because I know I've been at dinner parties and I've heard it's so hard to be quiet. When you hear people just their intent is not bad, but they're spewing information that's misinformation.
Yep. And you should just change the topic. If they're talking about Medicare at dinner parties, you got to find new friends, Mary.
I do.
At dinner parties, if I say, people go, "What do you do?" and I say, "I do Medicare insurance," they walk away. No one wants. I've moved to fighter pilot, and then their ears perk up when I say that.
So I would just like for you to talk a little bit about how do you approach that? So again, people who come from being overwhelmed to at least they understand a little bit. Again, you're not there to say this one's better than that one, but what are some of the questions or what's some of the process that you've alluded to in your book and your educational materials, your podcast or whatever, that you have found you've gotten rave reviews, individuals say, this has been really helpful. This is what I needed.
Yeah. So a couple of ways in my books and courses and podcasts, but it really is, there are no shortcuts to this. You don't have to be a Medicare expert. There are long cuts, I like to say. So if you think you're going to get information off a TV ad, or you think you're going to get education off a 32-minute call, or clicking an Instagram post, I mean, we all know that's not right, but not everybody does know that's not right. So I try to structure everything I do with kind of that insider's view. Look, let me cut through it. Let me hit you right with it. Here's option A, here's option B, here's option C. And here are pros and cons, my opinion, right? Based upon my experience. Here are pros and cons. And here are some other things to think about. You know what else I do, Mary? I also tell stories of real stories that people have asked me and real questions that people ask me. Again, I said people email me all the time, and I read every one of them and I answer every one of them. And they all have such very specific questions, like Irma and how, hey, I retired. I just got this notification from the feds that I'm going to be charged, $28,000 a month more. I'm kidding. It's not that much, but and I got a
There's
bonus.
that fear again.
Right. But these are so specific questions. It's that here's my whole thing. I'm going to give you the inside track. I'm going to tell you how these things work. I'm going to tell you how they're funded. I'm going to tell you why Medicare supplements are $180 a month and why Medicare Advantage plans sometimes can be $0 a month. I'll tell you why. Now you know. I'm going to tell you how they're going to market to you. You fit into a category of about 6 different profiles. And so if you see this is who they think you are. If you're a middle income, low income, upper income, high income, if you travel, if you don't travel, there are platforms out there that know almost everything about you, your financial profile, and your income over time, and exactly where you live, and they are targeting you.
And it's only going to it's getting more sophisticated with AI.
It's getting more sophisticated.
Yes.
I've seen platforms in the last 6 months that I could pull down more than 40 options on a screen, and I could narrow it down to your neighborhood and profile people that I wanted to profile to very, very specific pieces. And so it's called, at times, there's different phrases for the geofencing. If I'm a company and I want to target half of a zip code and then pull out 20, 30 to 40 different variables of things I don't want, I can literally do it. Gone are the days where someone's going to put, direct mail or, a piece of mail in your mailbox just willy-nilly. You might get one, and your neighbor 3 doors down may get the same one, but nobody else on your street. Your TV, streaming, let's talk about that. Same thing there. They know how old you are. They have an idea of how much money you make. They know your watching patterns, so they can kind of give you a profile. You're going to get an ad on Hulu or on YouTube that is custom tailored. Now,
so just for the record, I messed that algorithm up because I log in under my wife's account.
I mess it up too. I mess up my Spotify because when my daughters are over visiting, they always want to hear the Taylor Swift channel. So it's like a mix of bad 90s hip hop and heavy metal, and then Taylor Swift. It's very confused. But I guess my point is, you're going to be targeted based upon your profile way more than you were, and way more directly than you were even 10 years ago. And so you need to be educated. You need to understand how they're targeting you, why you're only seeing certain products, why you're only seeing certain products from companies. You need to back out, and you need to read. You read me or read somebody else. You need to read a credible source. You need to look. I've got a training. It's 40 minutes long. Watch it. Just go out and get the education. Don't listen to your buddy at the dinner party who knows. There's always one. Somebody who knows everything about Medicare, and because they heard it. There are so many blogs and AI generated, so much AI generated content out there. Find a trusted source you trust. If it's me, awesome. If it's not me, awesome. There are other really good people out there. And then listen and read and learn and consume, and you'll know what to filter out. So I guess I'll end that comment with something I said in one of my books. Like, the United States is, as far as I can tell, the only modern quote unquote society that puts their retirees through this type of thing. If you go to Europe, and I've never retired in Europe, so I don't know this to be true, but they have their own systems. It's easy. Why do I want my 79-year-old mother getting her Medicare Advantage plan canceled and calling me right in the middle of treatment? I don't. Why do we do this? Okay, well, we can ask all why all day long, or we can go out there and grab the bull by the proverbial horns and go learn. Again, you don't have to spend 20 hours on this thing, but pick up a book, take a course, listen to a couple of podcasts, from people who know what they're talking about, and then move forward. Just be aware of your options and how it impacts you.
I would just add to that, don't follow the herd, because it's a very personalized decision. Right?
Yeah, I agree with that.
It's so personalized. There are plenty of households where husband has a Medicare Advantage, wife has a Medicare supplement. Completely different ways of consuming Medicare. They're both different because it's individual.
So Matt, I know Mary and I could probably go on for an hour and a half.
Yeah,
2
well,
hours.
maybe we'll have Matt come back on.
Oh, I think we'll have to. I think have a new book. We'll have to have Matt.
Absolutely, because there's so much. We just scratched the surface.
So Matt, before we get to our final question, Mary's going to put all your contact info, your books, and so on into the show notes. But what's the best way for someone to get a hold of you? And then I'll ask the final question.
Sure. So my kind of, I guess, flagship website, if you will, has been for many, many years, prepareformedicare.com. It's where you can find me. It's where you can find some articles. It's I have a little section on there called helpful links, and I hope people smile when they see it. It's links to things that won't try to sell you anything. I think that's my title.
That's probably the only site on the web, on the World Wide Web, right?
I love that.
It's just, I'm like, okay, here are some good resources if you want to read some more stuff or reference some more stuff, and it's curated, right? That's the whole point of this, is that if I don't say it or I don't provide it, or you don't want to pay for a book or a course, that's cool. Read this. This is good. This is good. And I'm not including all the other stuff that's not. So you can you can actually make an appointment with the Brickhouse right on the homepage. Sign up for my newsletter. I do a newsletter. It's called the Matt Feret newsletter. I send about one a month. I hate spam too. And it has some Medicare stuff in it, but it also has retirement stuff. It's got Social Security news. It's not very long. It's personable, and sign up.
It's a good way.
Like I said,
good way for people get to know you as well.
Yeah, and I send useful information. Right, this is not sell, buy.
Yeah.
It's just, hey, I'm looking out. Here's what I'm seeing that that's timely. And so, prepareformedicare.com. But if you want to check out my podcast, it's on every platform you guys are on. It's also themattferretshow.com. That's been great. And then whatever, I'm all over socials as well. But email me, send me an email. Like I said earlier, I read them all and I respond to them all.
That's
so
great.
Matt, our final question for you before Mary wraps up the show. You obviously mentioned earlier you had a career in the corporate world. You know a lot about retirement, Medicare, Social Security, etc. Why are you doing what you do? What gets you up in the morning? What drives you? Share with us a little bit about that essence.
I like making things clear for people around complex topics. I like helping people. And I do that through education and insight. And I like publishing things. I like presenting things in public forums. I like speaking because I find it helps. Again, coming from 2 PhD college educators, that's just in my blood. And I spent a couple of years when I was a young buck in the news area. I was a local news reporter, and you meet all kinds. And you really, when you do that for that long, you meet people from all sorts of different backgrounds and all sorts of different places in life. And, people just want genuine understanding and help, and to be heard, and to talk to them, not talk to a topic, not paint in broad strokes, but to be very specific to them. And that's what gets me up every morning, Joseph. It's helping people understand and really putting them on the best path forward for middle age and beyond. That gets me up in the morning. I said earlier in the show, when I get an email, it makes my day. I don't know how else to say it. Hey, I got a question, Matt. I go, oh, I think here's your answer. And they go, God, that helps so much. Thanks. Throughout my entire corporate career, personal life, whatever, that's still the most rewarding for me. That's the best feedback I could ever get is someone asking me a question and I help them. That's the best.
Well, on that note, and I will say this, I do enjoy hearing that because in our society today, we don't always hear back from individuals that we reach out to. And so, again, kudos to you and putting the human and the trust, and also just the fact that you're caring, because you really do want to help people, and through your educational platforms and all that you are doing with Nikki together. We're really excited and going to look forward to hear more about your next book. And we hope you'll come back on. And again, we've just scratched the surface. So thank you, Matt, for joining us today. I know you're very busy. So, and I kind of scoped you on LinkedIn. Again, we talked years ago and I was like, oh, look at Matt, look what he's doing. I want to have him on because I think he'd be great. And you certainly have been. And Joseph, thank you again for, always joining me and putting a little bit of fun into this conversation, which I think is needed sometimes.
Medicare is fun. Don't let anyone tell you otherwise.
It absolutely is. And I think Matt would agree with you. He's been laughing quite a bit. So I think you're absolutely right. And to our listeners, we appreciate you listening to the Prime Life podcast, and please share it with your friends and give us feedback. And we look forward to next time on the Prime Life podcast. Everyone have a great rest of your day. Thank you.
Remember to subscribe to the Prime Life podcast anywhere you find podcasts. You can find all of our episodes, contact information, and more on our website, primelifepodcast.com. Stay connected with us. Follow us on LinkedIn, Instagram, Facebook, and TikTok.